We're live.
Yeah, that part. Oh, it's not showing up on my page. Oh, ladies and no, it's not. Come on. Oh, you locked them out?
I just closed it.
Sorry, y'all. Y'all give us a minute. Give us a minute. But welcome to the Ladies Den. I am your host, Bayou Diva, and my co-host, Lady K. We're gonna get this show going in just a few minutes. Our first engineer flaked out on us, Anthony.
Don't do that.
So
Oh,
we had to get a stand in. So we're literally getting things set up, but we good, y'all. We good. We got a doctor in the house.
Hey.
We're gonna be talking about some health stuff.
Okay.
It's not coming on.
It's there. You there? No, go to your page.
I was.
And then search for the ladies then. Do your thing. Search for the ladies then. Oh, come pull up.
That takes me back.
And then scroll up. And then there you go.
Oh, there we go. There we go.
Turn this to the side.
No, because it was sideways.
We were literally
like,
On IG, right?
yeah.
This one we're good.
So we're good.
Yay.
We're good.
Mm-hmm.
Yeah, I got recorded on that.
So everything's good. And so the mics are good, right? We're good. Mic check 1 2 1 2. It's a delay.
So turn the volume all over there.
All right, hold on.
Mm-hmm.
Yeah, we
Did the green record button go off?
Mm-hmm.
Oh yeah. Because we just have to press that record button.
I think I'm gonna see if
Like the power, it looks like it's not on.
a power record or something.
Only for us to connect with this one. What's up, y'all? It was on when I sat down.
It was.
It was. And I haven't touched it. I didn't even find out. So. We getting some power. Because our mic is on.
Oh.
We need to take that
Well, you get the This is the uncensored show, baby.
Uncensored. This is
Uncensored.
all the way live.
Yeah.
And I think that flashes.
We got this to be the old ladies den.
Support put this cord up.
We try to get.
I think that might be the one that got stuck in my chair.
Dang.
Y'all hang on. The cord got stuck in the chair.
Stuck in the wheel. Let me know when you're plugged in.
Yeah, we'll fix it later, but
Oh, that's what happened.
Okay,
and so I can't move my chair.
Okay.
yeah, don't move it up.
No, I'm good. I'm good right here. Yeah.
Okay.
That was me, y'all. I unplugged the whole thing. Sorry.
Some issues. Some power issues.
Okay. Yeah.
Get it now?
Whenever y'all.
Okay.
Yep.
We ready. We ready. We ready.
All right, ladies and gentlemen who are watching. We are ready to go.
Hey.
Welcome to the Ladies Den.
Welcome.
I am your host, Bayou Diva, and this is my co-host, Lady K.
What's going on, y'all?
We have a doctor in the house tonight, y'all.
Yes.
Got a doctor. So, you want to go ahead and introduce and
I can do this part. So, what's up, y'all? It's your girl, Lady K, as I've already said. And tonight's guest is a young lady that I have come to love, Dr. Bianca Kiovanni. And I'm going to read just a tad bit of this multi-page bio I have here.
Live on my page, so we can go.
No, because that's gonna pull from the ladies' den. Then folks gonna come to your page and they ain't gonna see her.
Okay,
Okay. Dr. Bianca Kiovanni is a licensed doctor of chiropractic with over 10 years of private practice experience. Over 20 years.
I'm 20 now.
See,
Right.
of private practice experience in Metro Atlanta. In her practice, she combines chiropractic, organic nutritional supplements, and rehabilitation massage therapy to help patients reach optimal health. I am a witness to that. Okay. In 2012, Advanced Integrated Healthcare was recognized as the number 1 medical practice by Atlanta Tribune magazine.
Oh,
Okay.
Congratulations.
Dr. Kiovanni's philosophy stems from the belief that the body is self-healing. She forms a partnership with her patients, she does, and encourages them to take an active role in their own health in treating the whole person. Dr. Kiovanni determines the underlying causes of any disturbance or disruption, which may or may not be causing symptoms at the time. Intervening with lifestyle adjustments and treatment conditions return to normal function. Using this exceptional approach, Dr. Kiovanni is able to help accelerate and/or maintain a good health journey with a proven record of treating a myriad of health issues ranging from migraines, disc herniations, to nutritional deficiencies. Dr. Kiovanni's commitment to optimal health and well-being of her patients ranks priority. She holds certification and advanced training in radiology, numerous chiropractic adjusting techniques, hormonal imbalances, detoxification protocols, and clinical nutrition. And I'm a just kind of, I was gonna say I'm kind of, okay, I'm gonna say this whole thing. Dr. Kiovanni is founder and owner of Advanced Integrated Healthcare LLC, a comprehensive center offering chiropractic care, physical therapy, rehabilitation, massage therapy, nutritional counseling, and saliva hormone testing. That's what I was telling you about. Dr. Kiovanni lectures and presents seminars on topics involving preventative healthcare methods, human physiology, and hormonal imbalances. She has successfully performed thousands of consultations and managed cases helping her patients regain their highest quality of life. And she got a whole bunch of degrees and certifications and stuff.
That's all you need to know.
I had to cut that short. We'll be here all night.
No, but I would like to talk about her education. Like,
Okay.
Yeah, at least say that.
Okay. She has a bachelor's degree in biology, a minor in chemistry, cum laude, Alabama A&M University, and then she has a bachelor's degree in life science with honors from Logan College of Chiropractic, doctor of chiropractic degree with honors. We go Logan
No,
College?
I just wanted to get her degree out there.
Oh, and she is a member of Delta Sigma Theta Sorority Incorporated. I couldn't leave that off.
Yeah, you can't leave that out. Yeah.
Okay.
Uh-oh.
God. Oh my God.
Welcome. Why didn't I know you 4 years ago?
I've known her of those 20 years, probably a good 17
of
those 20.
Yes, ma'am.
I just had my second ACD test in last May. I wish I had known you for an alternative method because I'm paying for it right now.
Literally and figuratively.
Yes. Yes. Wow. So tell us, like, what made you get into chiropractic?
That was not my original plan whatsoever. So when I was in undergrad, I originally was going to school to become a surgeon. So I was all things surgery, all things surgical.
Yes.
And when I was undergrad, I actually took a job working in a national pharmacy chain. And it was the things that I saw while working in that pharmacy that let me know this was not what I was willing to sign up for.
Oh, wow.
Working those hours, I would see the same people day in, day out. Prescriptions in the morning, prescriptions in the afternoon, prescriptions on the weekend, prescriptions for the husband, the wife, the kids, the dog. And it just started to really weigh on me. And there was one situation in particular when I really understood that this was not the path I wanted to take. There was a young African American boy, he was 6 years old, just gotten out of the hospital, he was very sick. And the prescription was for a prescription decongestant. We were so busy in the pharmacy that the pharmacist actually put hydrocodone in his bottle. The blessing was we had a series of checks and balances, so we caught it before we gave it to him. However, if we hadn't caught it and he took it as prescribed, he would have died.
Oh, wow.
And that would have been what we call in healthcare an acceptable loss, meaning our bad, it wasn't supposed to happen. It did happen, and we're really sorry about that. And it was at that moment where I said, you know what, there's got to be a better way to be able to engage the public, teach them about their health before we get this far down the road. And so it wasn't doing my research, I decided that the chiropractic profession would be the best way for me to be able to engage, empower, teach people about their health, teach them about their own bodies, so that they weren't needing the surgical services that I was, for so many years dying to provide.
Right.
Wow.
Wow. That is crazy. I know that all too well. I'm a nurse. I know that all.
That acceptable loss is very real.
It is very, very
and it's
real.
something
And
that
it
you have to
shouldn't
be
be
very comfortable with if you want any sort of longevity in healthcare.
Oh, wow.
Yeah, you do. I don't think it's fair, but you do.
It's not
if
fair,
you want a
it's not
job,
right, but it's what happens.
Yeah.
That's true. Oh, my God.
So tell us about your business and everything that you
So,
do and offer.
per the lengthy bio that Lady K secured from somewhere,
Right.
when I got out of grad school, I moved back to Atlanta. I finished my graduate studies in St. Louis, and so I moved back to Atlanta, Georgia. And I probably worked as a contract doctor for about a year just to learn more of the ins and outs of business. And I knew I didn't want to work for anyone else. I wanted to be able to, again, engage my patients in the way that I saw fit, in a method that I was comfortable with. I also wanted a practice where all patients, my white patients, my patients of color, my young patients, come and be comfortable. A lot of us don't share when we go to the doctor because the office is quick, it's sterile, there's not a lot of time, there's too many people, and people don't want to just really disrobe in terms of what they really had going on. And that's not what I wanted. So I founded Advanced Integrated Healthcare in 2000, probably 4 or 5, something along those lines. And I just wanted a comprehensive place where people could come and be comfortable, discuss their health. And I don't know everything. And my patients know that if I don't know anything, I'm going to send you to someone who can help you.
Yes, ma'am.
But we're not just going to leave you, and we're going to make sure you understand what's going on. How did you get here? How can we prevent from coming back here if possible? I just really, like I said, wanted to form that partnership with my patients. And because I've done that, my average patient has been with me more than a decade.
Oh, wow. That's
so
awesome.
I'm fortunate where we see 2, 3, and sometimes 4 generations of the same family.
Yeah. Because I would definitely bring all my folks to you. Anybody that comes here, first thing I'm like, you want to go to the chiropractor? You need adjustments? Let me call and get you an appointment real quick.
That is true. And now that we've all gotten more acceptable and comfortable with telehealth, I was doing telehealth pre-COVID.
Oh, wow.
I was doing telehealth pre-COVID.
How can you do telehealth with chiropractic?
Well, not the chiropractic portion,
okay.
but the nutritional portion. So we do blood work, we do hormone testing, we do neurotransmitter testing, we do advanced cardiovascular testing, food and environmental allergen testing. Those testings we can actually refer out. So a lot of my patients, I have patients all over the United States, some outside of the United States, because it would be, could you see my aunt in California? What about my aunt in Arizona? Can you see my sister in Alaska? That's actually I actually do have a patient in Alaska.
Oh, wow.
So it just kind of grew from there. Or some of my teenage patients, they go off to college. Well, doc, one, I want to see you in the office when I come home, but I need you to help manage, whatever I have going on while I'm away. And then even with my younger patients, again, I want that partnership. So if anything happens, if you don't feel comfortable talking to your parents, call me. So we can talk about it. We can figure out what needs to be done. Don't be out here making decisions that can affect the trajectory of your life because you and your friends got on the internet and thought you knew what you were talking about.
Yeah.
Yes.
So what signs would a person start getting to know that their body is out of alignment?
In terms of spinal misalignment, it could be things like headaches. It could be changes in posture. Sometimes just not feeling comfortable. We know our bodies fairly well, most of us. Of course, the traditional, aches and pains, but things like, numbness in the body, tingling, burning sensations, not being able to sleep very well, getting uncomfortable at night, tossing and turning. And that extends all ages. The youngest person I've ever adjusted was 3 days old. The oldest person I've ever adjusted was 95 years old. A baby? Yeah. Childbirth is violent.
Well, yeah, it is.
That's why. Childbirth is violent.
It's not really like that.
It's not for the weak.
It ain't for the weak, for sure.
It's not something that if it's not going well, look, y'all, just everybody go home and we're going to try this again
tomorrow. It don't work like that.
It's a process that has to be seen through.
Right.
And so you think about, there are some things that they don't use as much as they used to, but things like forceps, vacuum extraction, things of that nature. Why are we assuming that has no effect on that baby? A baby can't tell.
Thought about it like that.
And that's my job. My job is to think about the things that the average person does not.
Well, I mean, even as a nurse, I never thought about it like that because that's my background, OBGYN, for 13 years. So that's my background, but
a baby can't tell you about that. And
one
of my best friends, she's a nurse practitioner, and she said, how many babies are born with torn rotator cuffs or neck injuries and things of that nature? Again, another acceptable, not necessarily lost, but it's an acceptable issue. Again, we have to get that baby out.
Right.
But a baby can't tell you that their neck is hurting or their lower back is hurting. It may manifest with colic, digestive issues, crying, them not sleeping well because they're uncomfortable. So the beautiful thing is to adjust a baby, you only need your fingers, but so it's not the same way you would adjust a toddler or an adult, but they benefit from chiropractic care as well. In fact, there was an article on Business Insider today, a 7-year-old girl out in Silicon Valley in California, at 7 years old, she had never slept through the night. She had her adenoids removed twice. And her parents didn't know what to do. They put her on melatonin. It didn't matter. It was her going to see a pediatric chiropractor. And after 3 visits, that girl started sleeping through the night. That article just came out today.
Oh, wow.
So there's a lot of things that the general public don't know or don't think about. But again, these same issues can affect young people. You think about a child when they're learning to walk. They fall on their bottoms. They fall on their heads. They roll off of things. And when they start walking and running and crashing into things on purpose, and then they start playing sports. Why are we not taking these things into consideration? Right.
I'm looking all because it's just something you don't think about because it's a natural everyday thing, especially with kids. It's just natural. They fall down like, oh, get up, brush it off, and we just tell them to keep going.
Brush off maybe in their teenage years may manifest with lower back issues or knee issues or elbow issues, And the other thing is kids these days are playing multiple sports year round. So their bodies, while growing and maturing, aren't really getting a break either. So something like an adjustment, something like stretching, we do massage therapy to make sure their spines are reset so that they also don't grow into any challenges as well.
Right.
It's a lot to think about. But when you think about it, it's not rocket science, it makes common sense.
But when we're working, we're delivering babies and we thinking about that. Because it's just not something you think about that could have a long-term effect on a person.
Right.
Because as a baby, they go on, they go forward, they do all this. You don't think of the long-term effect that might happen. I never really thought about that. That is crazy.
Yes, there's those little babies that end up in our office.
Yeah, somebody like me that probably dropped and rolled over and kicked and everything.
Well, listen, I
was bad. I was a bad child, so I was in everything. So yeah, I was in everything.
My issues came from birth. They pulled me out with forceps and pulled my hip out the socket. So up until about junior high age, I could be walking around at any given time and my hip would pop out of the socket. and my mom them had to. So as a kid, I knew that my hip could be put back in the socket because of the way they pulled me out of the birth canal.
Wow.
And junior high was the last time I had an issue. I was playing basketball. I fell on the floor. My leg swung out too far when I fell. It popped out. That was the first wasn't quite an adult, but old enough to where what did it irritated a nerve, whatever that nerve is right there.
Yeah.
So my chiropractor at the time put me on, had to be on crutches like the whole summer. And he told me, he said, this is gonna grow back in. If anything ever happens after this, you're gonna need a new hip joint. Because the damage that it would do if it came out.
But think about how many times over the years that thing popped out.
It popped out, yeah. Even
if it popped out once a month, times 13, 14 years, that's a lot.
Yeah.
That's a lot of trauma on that joint.
And so that caused the scoliosis, which I still like. What you were talking about, how do you feel like you're out of alignment? I definitely get headaches from time to time, and there are times I can like stand. If I make myself stand up straight and one of my feet is not quite touching the floor, that's another way I know that I need to make an appointment to get an adjustment. Like it's crazy. It's great, and I thank God for you, ma'am. I appreciate you, because we've been through some things. Yes, we have. I was telling her about the saliva test, the hormone test.
Love that.
Yeah. Mm.
She's like,
it
wow,
a lot.
Wow. There's a lot, and that's another reason why I even agreed to do this podcast, because I want people to know, especially my communities of color.
Yeah.
Why? Because there are other communities that know way more than we know way sooner.
Yes.
And that's amazing, and I'm here for all of that. But I'm here as a woman of color to make sure that my communities of color have access to the exact same services and information. And the saliva hormone test is one of them. Make sure that whatever health decisions you make, are you making it with 100% of the information? Right. And a lot of patients, especially because I have a lot of nurses as patients, a lot of nurses will come in and tell me, dead yes, absolutely. And then I educate them and they realize I didn't know half of the things I thought I knew, or the things I held to be true. Obviously are not the whole picture. And that saliva hormone test, again, is one of them. And it's a way, because we are predominantly predisposed to things like fibroids, we're recommended faster for procedures like hysterectomies and things of that nature. But what if there was a test where you could figure out, am I predisposed to those things? Or how is it that I have a fibroid embolization 2-3 times? Why am I having to have a myomectomy more than once? What's going on? There is a way to ascertain that information if that person is A, willing to figure it out, and B, take the appropriate steps to correct those issues.
Yep.
Why hadn't I met you like 10 years ago? Because I've been there. I've been there with the fibroids. I had a myectomy. Then I had the UFE, and he said that they're not going to come back for 10 years. The next year they were back. So that's when I decided to just go ahead and do the hysterectomy. My doctor was like, my GYN was like, listen, I've done 2 procedures on you. You didn't have a UFE. We don't need to talk unless you're just going to do a hysterectomy. And I was like, you know what? I'm almost 50. I'm not having any more kids. Why not? But I fought it tooth and nail because I was like, no, I want mine. They belong in there. He gave them to me, so I feel like they belong in there.
They do.
And medically, all my friends like, you're a nurse. You don't need. I don't. What? I feel like if we're not supposed to have it, then we won't have it.
Right. Not only that, but who buys a new car to take off the trunk, the hood, the doors, and then will that car still drive? It sure will, but that's not what I paid for.
Right, that's not what you paid for.
That's not what we paid for.
And I regret it, but I regret doing it, but then I don't regret it because it's the best that I've ever felt. I have to worry about messing up my clothes and, all of that. But I just wish that at that time I had known anything about it.
Absolutely. And here's the other thing that they don't teach us is the uterus and the ovaries have secondary function outside of childbirth. Most women do not know that your ovaries are one of the main vessels responsible for blood pressure maintenance. That's why a lot of women post hysterectomy, they say, I had my hysterectomy, my blood pressure went up. It's supposed to, the ovaries are gone. The other thing is the uterus produces progesterone. And then it also produces cortisol. So when you take those structures away, there is going to be, maybe not sooner, maybe later, will there be some downstream effects from that? Yes, unless you put those raw materials back as if those structures were there in the first place.
Yeah.
And that's okay. And I think sometimes hysterectomies are absolutely necessary, but are you giving the full picture to that patient? Are you letting them know, hey, there may be some residual things you're gonna have to do. You can't just, like I said, cut structures out and send people home. That's just not how it works.
Yeah.
You'll be back because here's the thing. The driver of all of these symptoms has never been turned off. That's why someone has to have, well, I had to have this and then I had to have that. So you have to wonder the cause of all these problems. Did we ever address that?
Right.
Or are we just putting big band-aids on things?
Right. But she did address it though. She did address saying I'm gonna have to take hormones and this and that. So we did go over all of those
Wonderful.
things. But still, I wish I had a way, to know exactly, because then I wouldn't.
No, and it also begs another question that a lot of us in our community don't do, and that's discuss generational health. We don't discuss what grandparents had, what siblings had. And some of us, sometimes dad has some outside gifts, some outside people going on. So some of that history, just by circumstance gets lost. And so I tell people, if you have access to your parents, your siblings, and things like that, they may be uncomfortable, but ask those questions. You may be able to find out 10, 15 years ago, wow, if I had a sister or even a half sister, she dealt with this. Is it a possibility that I might be affected with this?
Yeah.
Yes, it is. So making sure we even discuss, like I said, our gender and our inter-family health as well.
Yeah.
It matters. It definitely matters.
Yeah. A lot of illnesses are hereditary. So it's always, and I tell my boys that mama got this. Your grandma had this, your grandpa, because a lot of people don't know. They don't know their parents' medical history. They don't know their grandparents' medical history. And that doesn't help them when something is going on with them because they can't pinpoint like where it's coming from or what, especially if it's a hereditary disease. They want to know like where, they're trying to pinpoint like where did it come from. But a lot of people don't know their parents' medical history.
No, they don't. And it derives you of the opportunity to be proactive.
Yeah.
Because in some scenarios, not all, but in some scenarios, I challenge even things being hereditary, meaning is the disease hereditary or is the deficiency in the behavior hereditary?
Yeah.
So case in point, pardon me, if you have a woman who's deficient in vitamin D and that woman gets pregnant and has a baby, won't that baby be deficient in vitamin D? So which one is hereditary? Right. The issues that come with the vitamin D deficiency or the fact that the mother had no vitamin D in the first place?
Right.
See how that works?
Yeah.
Again, it's a lot of paradigm shifting. And some things, we're kind of trained, don't question the doctor, but if you really sit back and think about some of these things, it's like, well, that only makes sense.
Yeah.
So if the mom had all those issues because she had no vitamin D and she passed that on to the baby, that baby's going to have the issues, not necessarily because it's hereditary, it's the deficiency that's hereditary.
Yeah.
And that's why, like I said, understanding the cause of things and addressing the cause of those things is super important. That's one of the reasons why, even as a chiropractor, lab work is very important in my practice. Right. What do we have going on, even from a natural perspective? Do you need this natural supplement? Yes or no? How much of it do you need? How long do you need it? Right. All of that matters.
Yeah.
Right.
So again, just taking, a traditional, a very specific approach tends to help. And that's how you end up with patients like Lady K for 15 plus years.
You about to get a new patient.
I tell everybody.
I don't know what we can do, but you might get a new patient.
We'll come up with something.
I tell everybody about it. But when you mentioned about knowing your parent medical history, I'm dealing with the thyroid issue right now, not knowing that my mom was dealing with it. The way that I found out, and I hope she's watching because I'm telling it again. The way that I found out is she had been taking meds for her thyroid. I don't know if she had hyper or hypo. Mine is whatever is too low. Is that hypo? Okay, that's what I've been diagnosed with. Okay, she had been taking medicine for quite some time. I did not know that. Next thing I know, I'm coming home to Texas for the holidays. Guess what she is? In ICU. Why? Because she tried to sneak and have a procedure to have her thyroid removed. And she was that whatever slight percentage that the surgery does not work out well because it's supposed to be an easy procedure.
Right.
And that's how I found out my mom had thyroid issues. Moving along down the line, all of a sudden, I'm exhausted. My skin's changing.
Wow.
It's peeling. And all this other stuff. I had no idea why. I'm thinking maybe I'm not eating right, not drinking, whatever. I go into do my annual. They run the labs. I always tell them to do full, take all the blood you need, do what you got to do. And that's when I find out that my thyroid levels are too low. Soon as I got that, start treatment, and I'm taking a prescription pill for it now. As soon as I start taking it, everything cleared up. All the symptoms start reversing. So I was like, and actually, when I first got diagnosed with the rheumatoid and then found out about the lupus and all of that, I started hearing, of course, a lot of, sadly, our older generation, they keep stuff secret, like we're not supposed to know. Found out it's a few aunties, my grandmother's sisters, that passed of lupus. Not necessarily lupus, but like something that came along with it. And to this day, I kind of know what my grandmother passed away from, but I really don't know if she also had that issue. Because one of her children, my aunt that basically saved my life when I got diagnosed with rheumatoid, was born with lupus. So she may have had it as well. And with her having to have children back to back to back to back, who knows what other deficiencies she was dealing with. But ever since I found out all of that, we have a family Facebook page. I get on there and I tell them, hey, y'all, listen, this is what's going on with me. Next time you go to the doctor, make sure you check this, and this. Because like one of my cousins, and this is from his father's side, but he has a sickle cell trait. He's the only one on this side that has it, but everybody else on his other side has it. Unfortunately, he had a child with another young lady that had the trait. They had a daughter. She had sickle cell. She passed away, unfortunately, a couple of years ago, just from she was in the hospital having a crisis and ended up passing away. So like, as soon as I find out stuff, like you just said, you tell your sons this and that. Mama got this. I tell all my people, listen, look for all of this because it's running in our family. And a lot of folks, you don't know what symptoms to look for.
I just felt like it was important for them to know because my mother was a very sickly lady. She had women issues. So I knew that down the line we would probably have. She also, it's crazy that you say that because my mom had thyroid too. And she had to get hers removed because it was blocking her trachea. And it was crazy because when they did the surgery, they nicked her voice box. She couldn't talk for about 3 weeks. And then they had to wait till that healed to go back in and fix her voice box. But, I that's one thing my mom would tell us what's going on with her. But her mom wasn't the type to talk about what was going on with her.
Like you said, they would put a blanket term on it. Women's or ladies issues, but you don't know what that could be specifically. That could be anything.
I just think it's important for your kids to know because man, things happen so quick and you just don't know, like, oh my God, you might pass out like what happened?
Right.
Why?
Right.
You know, and then the first thing they do when you go to the doctor is fill out the family history.
Mm-hmm.
Most people don't know
They
that.
don't know it.
They don't know that. So the doctors are like starting from square one
with you.
Yeah, instead of having a little piece of information that they can work with. So I just really think it's important that, you know, families, this day and time, you got to tell people, you got to share your health history. You just got to share your health history.
Yep.
That is crazy. But so tell us what else you do. The chiropractic, you do the hormones.
We do physical therapy. We do ionic foot detoxification.
Oh, what's that?
I'll take that back a second.
Okay.
We do breast and full body thermography. We have massage therapy again, and then we do the nutritional counseling, you know, based on whatever lab work. And then I also do traditional things too, like X-rays, MRIs, CT scans, ultrasounds if we need it. It's just how we apply that, you know, information. So I tell my patients, we still use a traditional data set. We're not out here sprinkling pixie dust over nobody or anything crazy like that, because some people think, and don't get me wrong, there are some of my colleagues in the field that do it. More power to you. I don't do it. But we take those traditional data sets. We just try to provide and take a more plant-based, holistic, natural approach if possible. It's not always possible. If a patient's going through active, you know, cancer treatment, we have to work within the confines of what we can do. You know, to your point, you know, I do have some patients with full-blown sickle cell anemia, and you have to work within the confines of what that patient has going on. So, you know, natural health doesn't mean be reckless. It doesn't mean, you know, don't do your due diligence, don't use proper techniques. It just means how do you apply that information, at least my practice, because that's the only practice I can speak of. Absolutely. So ionic foot detoxification.
Yes, God.
So the world is toxic.
Yes.
Okay.
Yes, it is.
Look, now, you know, with Instagram, social media, now we know people are toxic too.
Yeah.
But you think about, we drink and bathe and cook our food from water that comes out of metal pipes.
No,
You know, we all know about forever chemicals now. Those are the chemicals that stay in your body, you know, forever. You think about car exhaust, secondhand smoke, all of these things we come in contact with, they get into our body. How do you get them out? And that's where the crickets come in. So something like an ionic foot detoxification, it's a 30-minute session. You put your feet in a nice tub of warm water. We put a little unit in there that basically creates ions. And I don't want to get into the chemistry of it, because the chemistry brings me a lot of joy. It doesn't bring everybody a lot of joy. But, you know, when I explain it to patients, I give them a little mini chemistry lesson. They're like, that makes sense. And so we're able to pull toxins out of your body through your feet. And I know it works because one of my units, I know I bought a unit in 2006. It's got an odometer on it. That unit's got more than 30,000 minutes on it.
Oh, wow.
So if a session is 30 minutes, that's how you know. So either I've been sitting in there for the past 5 or 6 years myself, or we've been using it. We've used it on children. We've used it on cancer patients, stroke patients, you name it. We've used it on just about everyone. And the results are absolutely amazing. And I mean, some of the craziest things, I remember after I first got my unit, a young Black girl came to see me and she had braces, but she just had the bottom row taken off. She still had the top row on. And she said, one of the things that happened, she said, right after I got my braces, I became very depressed.
Oh, wow.
And we thought it was because, you know, you look a little different, you talk a little different. She said, no, I knew that something had switched in terms of my mental health. And she said it got bad to the point where she said, I did contemplate suicide a couple times. She didn't make an attempt, but she contemplated it. Turned out she went and did some independent testing before she came to me. She had heavy metal toxicity from the metal braces.
Oh, my God.
So she said, I would like to try your foot detox. And when you pull with the machine that I have, and this machine did not come off of Amazon, this machine did not come from China, and I did not pay China prices, okay? When we started the session, when metal comes out of your system, it's black. It almost looks like flakes of red pepper. I mean, black pepper, excuse me. It looked like at the end of the 30-minute session, I had taken 2 big containers of black pepper and dumped it in the water. The water was completely pitch black. And the room
Wow.
smelled like metal. It smelled like copper. Like, you know what pennies, like old
Yeah,
pennies smell
yeah.
like? But imagine this room like saturated with that
Oh,
smell
wow.
in a 30-minute session. And she said she went home, slept for the rest of the day. She said, I woke up the next day, I felt so good.
Wow.
You can't make some of this stuff up. I've seen
cannot.
it in my,
Wow.
in my own practice. I've seen it. Now, is that going to be everybody's situation? No, but again, I want people to know, do you have more options? Because some people, colonics, especially some of my male patients are like, Doc, I'm not doing that. I know it's therapeutic. I know it will help me. And they still, I don't do them in my office, but I recommend some of my patients that they go get them. But some of my male patients are like, Doc, I can't do this. I'm not doing it. They tell me, I'm not putting no hose anywhere. And I'm like, first of all, hose is not what happens. Nobody's doing that. That's not what happens. And so, I try to educate. So did you know that's not what happens? Let me explain what happens. And some of them do go on and say, you know what, I went ahead and tried it. I'm glad I did. I feel so much better. And that's another passion for me is men of color. They do not discuss their health at all.
They don't want to go to the doctor.
They don't want to go to the doctor. So again, I try to create an environment because they know the first thing we're not going to do is we're not going to judge.
Right.
All I want to know is what you got going on so I can help. Right. And again, if I can't help you, I want to send you to someone who can. Right. And that happened, it was a year ago with a longtime patient of mine. He had moved to South Florida. He moved to Miami and he got COVID. Mm-hmm. And so that was fine. So his doctor down there was treating him for COVID. He called us about a month later. He said, Doc, I've had COVID. I'm testing negative. He said, I still don't feel good. Mm-hmm. I said, okay, well, I'll order some blood work for you down in Florida. The lab called us in Atlanta and said, is this the right patient? Is this sample this individual? Because this doesn't make any sense. Long story short, for some reason, it was the grace of God. I checked his iron levels. Mm-hmm. His iron levels were at 2%. Now we're talking about a grown man, and we know men don't have cycles. Right. So where is this blood loss coming from? To the point where this is not even severe. This is critical. Yeah. Right. So they were like, where is this patient? I said, the patient's down by you in Florida. So I called him. I said, listen, I said, can I ask you something? He said, yeah, what's up? I said, pardon me. I said, I have to ask. I said, but by any chance, I said, are you bleeding from anywhere? Here you go. Yeah. I said, I'm sorry. What? He said, yeah. He said, he'd been bleeding from his rectum for the past 6 months. Never said a word. Did he know he could die? I said, how long has this been going on? Because again, it's December. He said, since May. Oh my God. I said, okay. I said, well, let me ask you this. I said, have you gone since you moved to Florida? Have you gone to have a colonoscopy? Have you had your prostate checked? No, I was going to do it, next time I came to Atlanta, something like that. I said, you may not make it getting on a flight to Atlanta. Yeah. Not with the 2% iron saturation. And this is negative. Oh my God. Well, what happened? He was adamant on coming to Atlanta. I had gotten another colleague involved who was a medical doctor, who was a Black male. And I said, listen, I need you to help me, advocate on his behalf because he's kind of half listening. Mm-hmm. So we were able to, he in a couple weeks was able to safely fly to Atlanta. He had to have an iron infusion. I referred him to a colorectal specialist. And I said, you've got to go get this checked out. And come to find out what he had was internal hemorrhoids. Oh my God. So he couldn't see them, but they were there. They were on the inside. And the pressure was what was causing the bleeding. And I said, well, since we're checking everything out, you may as well go ahead and get that good colonoscopy and get your prostate checked. I said, not because they're going to be in there anyway. Get it all checked out. The blessing was he didn't have to have surgery. Or anything like that, and everything on his colonoscopy came back perfect, but he could have died. Yeah. Just from not sharing that information. And that when I asked him if he was bleeding, he answered me as if I asked him, was he a man or not? He said, yeah. He said, yeah, since May I've been bleeding. So then I started asking my other male patients on the humble, like, can I ask you something? have you had a colonoscopy in the past couple years, especially anybody 48 and older?
Older, yeah.
No, I know I
Absolutely.
need to get to it. Okay, can I ask you something else by any chance? Do you experience bleeding from time to time? Do you know I had 3 men tell me yes? And again, had I not asked,
They wouldn't have said anything. I don't know why men are so embarrassed to talk about their health, especially if it's something back there.
and I get it, and that's why
I get it, but it's your health.
I'm like, look, next steps. I'm not even gonna process any of that.
Right.
This is what we're getting ready to do next. You know, and that's why I partner with providers that have a certain type of bedside manner so that, you know, I don't send my patients to a provider that I don't know personally.
Okay.
You know, so that I know if I hand you off to someone, you're going to be treated a certain way, you're going to be respected a certain way, because we know that there are disparities in terms of how healthcare is administered across cultures. We know that.
Yes.
So I want to make sure I send you to a place where they're going to be treated, you're going to be respected, your issues are going to be taken seriously. But yeah, I've had 3 men take me up on that whole colonoscopy check just on the strength of that other patient's story.
Wow.
That's why when people ask me how work was, I usually don't want to talk about it. I'm like, it was a lot. Don't regret it. How is everything? It's a lot.
It's too much.
It's always a lot.
Right.
Yeah, but when we leave work, we don't want to talk about what happened at work. True. The only time I share something is when I had a patient die on me, and it was one of those that I really started to feel for, and really, then I talk about it. But other than that, I don't want to talk about work. What's happening?
You know, there's a lot of that too in our culture now that's starting to come up, you know, the mental health. I've even done that as well, starting, you know, forming partnerships with mental health providers, men and women, so that everybody can feel comfortable. Again, go to someone that's relatable, you know, may have shared similar experiences, so you can have that level, like I said, of transparency without judgment. And, you know, that's something too, as communities of color, we've really swept under the rug, you know, seeking mental health services, you know, talk to Jesus, praying out.
Well, because the stigma is, if you're going to a psychiatrist or a psychologist, that you're crazy. And that's not actually what it is. You're just going to talk to somebody other than your mate or your mom or your dad, somebody who doesn't have an objective opinion about what you're saying and not going to judge you.
Right.
So, you know, that stigma back in the day, before our time, is she crazy, she needs to go see somebody. So that has carried on through generations. So that's why people, I'm not going to psychiatrist, I'm not crazy. You don't have to be crazy to talk to someone.
Right.
And that's why we're losing so many of our celebrities, our kids, and everybody, because they feel like if I go talk to them, people are going to think I'm crazy. They're going to look at me a certain way. So, yeah.
And just the emphasis on what other people think now is that in all time, everybody cares about what everybody thinks. And it's just like, oh, wow.
And you know, I want you to maybe you can clarify this for the listeners and for people. I get this all the time. My friends will call me and they'll say, oh, that doctor didn't know what she was doing. She gave me this and I had to go back and get something else and this and that. Or they had to try 3 or 4 different medications. And my response to them is, they're doctors. But if you know anything about medicine, they're practicing medicine, which means you might have to go through 4 medications before you get something that works for you. And I'm not a doctor, but I explain to them that for high blood pressure, these doctors might learn 2,000 medications. So out of those 2,000, they don't know what's going to work for you. So they might try something with you that might be closer to the symptoms that you have that they feel might work for you. So kind of, if you can kind of, I don't know how to clarify that, because it's just, you guys are practicing medicine.
That's practicing. So, right. And that's where I take a little bit different approach. And most people don't know that 40 years ago, they stopped teaching clinical nutrition in medical school. That's why a lot of your providers across disciplines, across specialties, don't necessarily or really don't want to have an in-depth nutritional conversation with you because they don't know the information. Okay. So there's that. And then to your point, a lot of them are practicing medicine. So a lot of times, unfortunately, if you take away the prescription pad from most providers, they can't do anything for you. They can't teach you anything, or the information they give you is what I call excruciatingly generic. Well, eat better. Well, if you eat at the gas station and I don't, and I'm comparing my health to you, I think I eat pretty good. But I'm over here at the 24-hour fast food place. So technically, we're on the same page. So they'll tell you, eat well, what does that mean? What does that mean? I work third shift. What does that mean for me as an individual?
Right.
We're not having those specialized individualistic conversations. Everything is very blanket and very generic. And for me, a lot of times, again, it goes back to what's the root cause. You know, again, going back to that saliva hormone test. If you have adrenal glands that are not functioning properly, that puts you at a predisposed risk for high blood pressure. That's issue number one. It's a woman who's had a hysterectomy, you've had a complete hysterectomy, and those ovaries are gone. There's a second predisposition for high blood pressure. If you are a pre-diabetic, full-blown diabetic, there is a third predisposition. If you are deficient in vitamin D, as in David, okay? Vitamin D is a natural ACE inhibitor, okay? So there's a fourth predisposition. And see, some things will come in with all four of those predispositions. And then wonder, why do I have high blood pressure? And then wonder why, to your point, a doctor may have to try different things. I sometimes, if possible, will challenge that and say, you know what, let's do some blood work. What's that vitamin D looking like? What are those electrolytes looking like? How much water do you drink? You know, sometimes high blood pressure is a viscosity issue. If the person isn't drinking any water, the blood's going to be abnormally thick, which means your heart's going to have to work harder. Does that not make sense? Does that mean that person has high blood pressure? Yes, but it's temporary. You know, but some of us love to take a diagnosis and we'll wear it like a badge of honor. Girl, I got this, and honey, I got that. Why are we claiming these things? Not, well, you know, I have this for now. I'm trying to work my way out of this. And you know, it's a good book that says the power of life and death is in the tongue. What are we speaking about our health?
We have a lot of WebMD doctors out there.
Well, you know, WebMD, if you Google anything, you'll get your affairs in order. Tonight. Get that, go and click on that life insurance policy ad on the right, get your affairs in order, put somebody's name down to get that check because you get ready to get up out of here.
And we got that a lot in OB. Those women will come in and say, oh, I saw this on the internet and they said if I do this, oh, this gonna happen to my baby. I'm like, I used to tell them, baby, look, stay off the internet. Stay off the internet and talk to your doctor. And a lot of things I find as a nurse too, that they'll leave you as a doctor and come to me and say, well, what do you say I got? Or what's going on with me? And it's like, did you not talk to your doctor? Don't ever, and I tell my patients, do not ever leave a room or have a doctor leave a room if you don't know what's going on with you.
But that happens more often than not.
It does, and that's what I'm saying. They do it all the time, and then I have to go back because most of the time the doctors are not charting right after the patient leaves. So then I have to go and say, okay, well, Miss So-and-so, what's going on with her? Because she's asking me like, and then they're like, oh, I gotta get blood work. So he didn't tell me. I know he told you what you need, what blood work you need. And then they ask, okay, we tell them, and they're like, well, what is this for? You didn't ask the doctor?
Right.
I'm not a doctor.
Right.
So I wonder, like, what can we do to get patients, I guess, to want to be more knowledgeable about what's going on with them.
That's the main thing. You can't want it more than the individual does. And why would you, and my question would be, why would you want someone to have that much power over you? Why would you want that? You know, understand, like you say, the way my mentor taught me when I got out of practice, this was one of the most powerful things anyone ever said to me. She said, and she wasn't even in healthcare, but she said, you know what? She said, if you can't teach it, you don't know it. I don't care what it is. So for me, I should be able to take the most complex healthcare situation, and if I can't explain it to the point where that person across from me is not satisfied and they understand, as far as I'm concerned, I have not done my job. And so anytime I sit down with a new patient, that's the last question I ask them. Did I do my job? Do you understand? Do you understand the course of action? Do you understand what our next steps are going to be?
Right.
Do you understand this is what you want to work on? This is what you told me you wanted to achieve. And I'm meeting you halfway to say, okay, these are at minimum, this is the test we need to do to get started to figure out that process for you. So I make sure I ask, but a lot of us, we get in the room, we get intimidated, or some of us, we talk real big on the internet, we talk real big to our friends, we get in that room, and then the situation changes.
Yeah.
But it's like, whose health is it? It's not that doctor's, it's that individual's.
Right.
It's yours.
Yeah.
So again, why are we giving our power away?
Right.
And then we expect that doctor to care about us like he's our family member or she's our cousin. It's like, that doctor got 50 patients to see today.
Right.
And as much as they want to care about you, guess what, sweetness? They don't. They got too much on their plate.
Yeah. Yeah.
And then we don't see, and then we'll put up with that. So I tell my patients, if you don't feel like your issues are being heard, find a provider who will.
Yeah, because now they do have those doctors that come in and they're in the room 2-3 minutes and they're gone to the next patient. So they really don't have time to ask those questions. But for the doctors that I know that I've worked with, they'll be in there for a minute and then they come out and they still don't know what's going on. Like, how do you not want to know? I start sweating. I'm like, oh, wait a minute, I'm sweating too much. I'm going to the doctor. I'm that because, and you laugh, but I'm serious. Like my sister is sickly. Like I thank God that I didn't get a lot of the things that my mother had. My sister was, she took on a lot of those things from my mother and my father. So for me, if I don't feel right, I'm going to the doctor. Because I know my family history and I know that it could be anything. And it might not even be something that was with the family history, but I know my body.
Right.
And my sister, they never won't go to the doctor for nothing. Yeah. That won't go. She won't go. She might be watching. She won't go for nothing. And it's like, girl.
But she may, but if you ask her, she may feel like, you know what, the one time I really tried to put myself out there, they didn't listen, or I got my health issues shut down. Most people don't realize that they used to do medical experiments. They used to do surgery on Black women and not give them anesthesia because it was the perception that women of color, Black women especially, could not feel pain. That's medical fact.
Wow.
I tell people, if you're watching, Google the story a story of Henrietta Lacks and figure out who Henrietta Lacks is. Okay. So there's a lot that's been done to us, or like I said, maybe she feels like she wasn't heard. And so just forget it. I'll figure it out, or I'll let the internet teach me, things of that nature, which sometimes can work, but a lot of times it doesn't, or it's too late, or by the time you do go to the doctor, these options that you could have had are no longer available to you.
Yeah, because it's too late.
Absolutely.
Wow. Wow, this is interesting. I learned more than I thought I knew. More than I thought I knew. I'm learning, y'all. You never know everything.
No.
Especially in the medical field, because medical is forever changing daily. Like they're always coming up with something new on a daily basis.
That's the other thing. So to your point, as medical providers, and this, we're supposed to do something called continuing education. So for me to maintain my licenses, because I have licenses in several states, you're supposed to do a certain amount of education. Did you know that most of your providers will take the same classes over and over and over again?
But don't they tell you what you need?
Some providers will take the same class over and over again.
Wow.
And those are usually the doctors that tell you, well, this is the way I've always done it. This is the way it's always been done. We do understand that even post-pandemic, technology is changing rapidly across industries.
Absolutely.
Why would healthcare not be one of them? So a lot of your doctors, you may want to ask, hey, what do you do different types of continuing education? What are you doing to stay on the cutting edge? I share that information with my patients. Hey, I'm not going to be in the office tomorrow. I'm doing a seminar. I'm going to do an advanced seminar on thyroid health and adrenal health. And I can't tell you how many times I walk into these seminars. There must be 120 plus providers, and I may be the only, or there's 5 or less people of color in the room.
Mm-hmm.
Wow.
I've had people ask me, are you in the right seminar? Are you in the right seminar? I remember that. I took a seminar up just north of Atlanta. And this lady asked me, she's like, are you in the right seminar? And I said, do you work for the hotel?
See.
So if you don't work for the hotel, what I would not need is for you to be concerned about my comings and goings.
Mm.
So the seminar was 12 hours. It was 8 hours the first day. It was 4 hours the second day. I waited until the end of the 8 hours and I started asking questions because during the lunchtime, I sat by myself. No one spoke to me. No one talked to me. I think it was myself and another Black female. And I think she left the seminar for lunch. I sat at the table by myself. No one had anything to say to me till I started talking at the end of the seminar. Then everybody wanted to talk to me. By the next morning, I had a crowd of people around me, all kind of people bouncing questions on me. Can I come shadow your practice? Can I come see what you're doing? You most certainly may not.
I was about to say, I know you
most
don't
certainly could, because I was, according to you, I wasn't supposed to be here yesterday. Come to find out, I know more than you do.
Wow.
But the unfortunate part was why, communities of color, why are there not more providers of color in these seminars? Or these people are going back to their suburban practices. Where are the people that practice in the cities where this information could be immediately applicable?
Wow.
Right.
That is crazy.
Now you do a class. Are you going to be doing that again anytime soon?
Yes. I prefer to teach in person, which we have not been able to do for several years.
Yeah.
I teach classes on hormone imbalance. One of my favorite classes is decoding female hormones, where we explain what these hormones are, what they do, what happens when they're too high, what happens when they're too low, how do you assess it, and most importantly, after you assess it, what do we do about it? Because a lot of times we've been given labs where things are not normal and we kind of left to fend for ourselves. Like, well, I guess I'm gonna go to Walgreens or get on WebMD or go ask Amazon. So, I want to demystify. Let's put the information out there. I teach classes on vitamin D, gastrointestinal issues, classes for senior health, a lot of different topics, so that, again, we can at least go, to your point, the next time we go to the doctor, I do have some questions for you. And you're not about to rush in and out of here in 2 minutes. And if you're too busy to deal with me, that's fine. I'll just take my business somewhere else. You don't work for that doctor. You don't work for that nurse practitioner, that physician's assistant.
Right.
They work for you.
Right.
And make sure you're getting the most out of that relationship.
Right. Don't play with me.
So yeah, what is this? This is March.
Yes.
I'm gonna shoot for April.
Okay.
And this time we're gonna do a dual class. So I'll teach in person and then we'll stream that class as well.
Okay. And then where can people find the information about your upcoming class, about your practice, about everything we just talked about, to get in contact, to get on your books? My books.
I just need an appointment.
My books are full.
Your books stay full.
My books stay full.
Now, are you the only physician in your practice?
No, there's another provider, Dr. Garcia, in my office, and his books are full.
They stay
Because
booked
people
and
understand the type of care that we provide.
stay booked.
Which is a good thing, but there are only so many hours in the day. So, yeah. So the name of the practice is Advanced Integrated Healthcare. We are in Atlanta, Georgia. You will find us on Instagram. There's not a whole lot on Instagram because we're too busy to post stuff. So it is Advanced Integrated Healthcare. But what I'll do is, as soon as I get a firm date and a time, what I will do is I will share that with the ladies' den. And that way you can share that with your subscribers, but come and learn something, you know, if not for yourself, for a family member, like you said, maybe for a sister, the information may not be for you. I just want people to, I just want people to have it, you know, and know that, wow, I didn't know that these options were available. Or I didn't know these treatments, you know, were available. I didn't know that this was something that, you know, could possibly be, you know, for my benefit. We just want people to know, like I said, what's going on in 2023.
Will the hormone thing benefit me now, being that so I've had?
Yes, because if you don't turn off hormone imbalance, that's the situation that happened with my own mother. My own mother developed fibroids because she got married young and had her children very young. So my mother developed uterine fibroids, and they dismissed it. In fact, she was at work one day and literally just started bleeding out. She drove herself to the ER. Her uterus was so distended, but because she was young, they ran a pregnancy test on her. They thought she was pregnant.
Oh, wow.
And she said, my kids are teenagers. So she ended up having an emergency partial hysterectomy. We didn't even know until after my dad, we just knew she didn't come home from work. We didn't know where she was till the hospital called. So there was no discussion, you know, what are our options? They called us after the procedure had been done. So then, you know, obviously a partial hysterectomy throws you into menopause. So we all had to take a crash course in menopause. What does that mean? What does that look like? You know, and I grew up north, so why is it 12 degrees? Why does this woman have a window down? I'm freezing to death. She's sweating. Everybody gonna die. It was not a good time. So understanding, so just a few years after that, my mother was diagnosed with cancer.
Oh, wow.
And we're like, well, wait a minute. How, you know, what's happening? What's going on? What I didn't know then that I learned now in my studies, again, hormones are just like these lights. They're on until you turn them off. If you never turn them off, maybe not now, maybe 6 months, maybe 6 years from now, could that hormone possibly come back and revisit you in a way that you do not prefer? Yes, it can. So why not know where you stand?
Right.
You know, and again, things are changing so much. You know, think about something like a heart attack. That was an older man's issue. How many of us know friends, family members, co-workers, people under the age of 50 that have had heart attacks and or strokes? The dynamics are changing. You know, so we can't put everything off anymore. Why not take some time just to know where you stand? And if everything is good, amazing. Let's keep it that way. If not, what do we need to do to get you to your best version of perfect, whatever that is?
Right. Wow.
Whew.
I need to get on schedule.
Make sure you're following Advanced Integrated Healthcare. You on Facebook.
Sandy Springs, right?
Yes, right around the corner from
here.
Up the street, make a left, and
Now, how do you find the time?
Oh man.
Tell us about these beautiful drinks here. They all look good. Is this something you have within your practice, or?
Sort of.
We were taste testers.
Right. Those in the know. Those in the know. Yeah. So Anissa will attest to that. So I also own another company called Simplicity Beverage Company. Okay. And what Simplicity Beverage Company is we create non-alcoholic, vegan, gluten-free, organically cane sugar sweetened teas and lemonades. Okay. So these are clean label products. So you can flip my bottles over and understand every ingredient on the label. There's no number, nobody dies. There's no poly, nobody dies. There's none of that.
Oh, and it's only 100 calories.
So the beautiful thing is they taste good. And so it came from educating my patients. Like, well, look, you know, coffee is not bad, but that venti triple shot with the 18 pumps of caramel and the double whipped cream, if you do that 7 days a week, it's gonna come for you sooner or later. You know, stopping at the gas station isn't bad, but if you get a big bag of chips and a soda every night, that soda's gonna come back for you. So I say, can we create a clean label product that tastes good, but we're not compromising on the ingredients?
Right.
So the 4 launch flavors are the Basil Breeze, which is the basil lemonade, the Fulfillment, which is green tea infused with mint and honey, Guava Goodness, which is guava lemonade, and Island Time, which is the hibiscus tea with pineapple, lime, and ginger. And so Anissa's right, Lady K is right. So I work a lot, and people would tell me, well, you gotta have a focus group, you gotta have people try it. So I said, oh, I'm gonna try it on my patients.
So did.
So she would come into the office and I would say, hey, how you doing? Listen, taste this. You like this? Does this taste good? Would you taste this? How much would you pay for it? I've cooked for her a couple times
Oh my
before.
God.
She, I've cooked for her. My mother started it, you know, and then I took over. And so she was saying, well, Dad, I know you're busy, but you think if I go to the grocery store and I drop everything off just the way you want it, you think I could pick up a couple quiches in a couple days?
Yeah.
I've done it. I know she hasn't asked me recently, but I've done it. But that's just how I am about my patients. But you know, Anissa took a chance on me when I was very new in practice, you know, and she's seen the evolution of things over the years. And I'm so thankful for you for doing that. So I have no problem showing my appreciation right back, you know, because I'm of the mindset that I learn just as much from my patients as hopefully they learn from me. It's not a one-way relationship for me at all.
The way it's supposed
Yes,
to be.
look,
So how can somebody find your drinks? Is there like an online
that's just like
or
the practice? We be busy. So here, if you're here in Atlanta, you can buy them at several gas stations in Buckhead. We're literally posting all of that. We're in a lot of hotels, so like the Atlanta Marriott Marquis, the Hyatt Regency, the Hyatt Centric. We're literally, there was some technical difficulties literally right before I came to this podcast. So the online store is on hold for probably 2 to 3 days till we fix some technical IT issues on the background. But we do ship locally and nationally.
okay?
So we're able to get those products to California, Alaska, Arizona. I know you want to take that.
That's a beverage company, y'all.
Yes.
Let's crack these bottles open.
Okay. So
I know the ice probably melts your
Is
Can we get? Can she? I don't need no ice. I don't like.
Does anybody
have any questions?
Let's see.
No. No questions. Everybody's saying how the information that you were given earlier was awesome. Good information to have.
Oh my God, this is good. I love hibiscus. So this is good, y'all. This is called Island Time. It's hibiscus tropical flavored tea.
It's got pineapple, it's got lime, it's got
Ginger root, B vitamins, iron, potassium, phosphorus, and zinc. Contains pineapple, bromelain, and anti-inflammatory properties. Right. That's good.
So you want to try some engineer? You want to try some? Where your cup at?
Most definitely, I'm gonna get it now.
So you doing me like I did you with the wine?
Really?
Why you give me my message? Those are mine.
Oh, I thought they were for us.
I never said that.
Oh, I'm sorry.
I never said that. Rewind the book. I'm gonna say rewind the tape. I never said that. I never said that.
Oh, silly. Oh, that's just my TV. Oh, that's my TV. Oh, this is everything.
So see, you can have a product that tastes good.
And it's healthy.
Yeah. You need that in your life.
It's better than a wine glass too. That's the young lady.
Oh, this is really good. This is real because I like just regular hibiscus tea. So, are you taking that back?
But I don't know. We don't.
You gonna give us $20, guys?
I didn't know that.
How much are they? So, what do they retail for?
$5 a bottle from now. Subject to change without prior notice.
Come on, baby. Thank you, appreciate it.
So this is the basil freeze. This is the basil lemonade.
So now we're trying the basil brie. And you know, I'm from New Orleans, baby, so we cook with basil.
Yeah.
You don't like it? Well, no, don't do that.
It's kind of strong.
You think
It's not nasty. It's just
it's basil?
that.
I like it.
But I might need to taste it again. I only took a little sip.
Yeah, I'm taking on stuff.
And for the folks like me that like to do a little libation,
Real good. Oh,
you put a
Yeah.
little vodka.
Well,
in
you know
there.
what? I was about to say that because it's not.
It can. I'm not gonna discuss that on the live. We gonna turn that off. But yeah, we'll talk about any adult
What's
versions of said beverages.
Cocktails.
Yes.
Great for
mhm.
cocktails. Just FYI.
Actually, it is pretty good. I had to take. I guess maybe because I had that still
Mhm.
on my palate, but I like it.
Because I actually
This would be good. This is good. Red.
with some red.
Some red beans.
yeah.
While she doing her laundry.
Okay. Yeah, yeah.
Mm-hmm. This is really good.
Mhm.
Y'all, Simplicity Beverages.
If you on Instagram, it's Simplicity Beverage Company.
Simplicity Beverage Company.
Look, it's not a lot on that Instagram page either. It's some stuff, but we fixing all of it, y'all. We did. So this is the guava goodness. This is the guava lemonade.
Okay.
Engineer said, "Don't leave me out." It made me don't leave me out.
Drink on too.
Don't leave me out.
And this is guava. Have I ever had guava before?
This is really good.
Oh man.
Put some rum with this.
Oh, this is good.
Oh,
I like this one.
Mm-mm.
Oh, this is good. Mm.
I'm gonna save mine.
You got some red beans?
Now look, talk about cook.
Whatever you want, baby, I'll bring it to you. I love to cook.
Do us like
Talk about
even
cook.
exchange.
This. Y'all better barter.
Mm-hmm.
Lemonade for gumbo. Lemonade for red beans.
Anything you want. And I don't have
That was
no
good. You like
I don't have no cats running all around my damn house
listen,
either.
no, I tell you, free smoke, free COVID, free home.
Oh yeah, most definitely, most definitely. Oh, that one. I think I like this one better.
The guava.
This is
Then that
America.
one.
You don't have a favorite. Buy them all. My sales department.
Oh, I
me
will.
wants you to buy
Me
them
and
all.
you.
Yeah, I will.
My sales department.
Yeah.
You brought some extra ones with
Cut the eyeballs.
you? Look, y'all, we gonna cut out here early.
Oh my
We gonna cut out here early because we got a bottle of tequila under the table.
Oh my god.
So we about to have a good
I
one
gotta be
now.
back at work in the morning. Don't have me out here bad.
No, but yeah, I want to try this one. One more.
Green tea infused with mint and honey. I
Mint
like this
and honey.
sometimes in the morning, like if I don't want water, but
Now,
I
can
want
any of
something
these
a little.
be drink hot?
I've never tried that.
You never tried it hot?
I've never tried it. Oh, I'm sorry.
So now we're trying the green.
The fulfillment.
It's fulfillment, like
Mhm.
MINT.
Yes. Sir, no, it don't.
It do.
No, it don't.
It do.
No, it don't.
No, it's a good thing.
Real
I'm
good.
gonna die first. Say no.
Yeah. Oh
Okay,
yeah.
No.
Drink, y'all.
I don't know.
Really?
I don't think they heard him.
How did we get here? It's 8:20.
Okay. This is good too. I like this one too.
I have to tell y'all about a little.
This would be good like if you're sick.
Fulfillment.
Mm-hmm.
I like that.
Fulfillment.
Yep.
MINT.
M-I-N-T.
Oh.
Yep. And see, they need to be like ice cold. Like when they're ice cold, they're amazing.
But they're still amazing. These are really good,
Yeah.
healthy,
Yeah, they're vegan.
vegan,
Gluten free.
gluten-free
Mhm.
lemonades and teas. Y'all gotta try it. Simplicity Beverage Company on Instagram,
Yes, ma'am.
Facebook,
And
Okay,
Facebook.
and Facebook.
and Facebook.
I'm not gonna tell you.
Oh, okay.
Okay. So just Facebook and Instagram, Simplicity Beverage Company. Y'all got to try these. They are delicious.
Delicious.
And right now they're retailing for only $5.
For now, subject to change without prior notice.
Hey,
Subject to change without prior notice.
it is what it is.
But they're gonna be $10. $10. Taxes
It's worth
included.
it.
So you can see this. And so if you look on the fronts of the bottles, I wrote, and so that's how I was able to fuse
Mhm.
a little bit of advanced integrated healthcare into Simplicity Beverage Company. So on the fronts of all the bottles, I wrote and trademarked what are called the droplets of knowledge.
I saw
Those are
that
the healthy factoids about what's in the
in
bottle,
each one.
so that we can be more aware of what we are consuming. We are consumers. Why are we not more aware of what we are consuming?
Right.
Right.
You would think.
Wow.
You would think.
Yeah, these are nice, y'all.
See those
Simplicity Beverage Company. Y'all could try
You read your
some of these. Yeah. No, I
You
didn't.
read it.
I didn't read it. I read the other two. Oh, this has vitamin C in it.
Mm-hmm.
And no, these are not produced in my home. We have a whole co-packer, so they're mass produced here in Metro Atlanta.
Good stuff. Good stuff.
I don't know where they produce that. They're good. Those are really, really good.
Mm-hmm.
All right. The doctor knows best.
Okay.
I'm just saying, there's 100%. There's no 2% juice in here, 1% juice.
And 75% water.
Right, micro fortified, number 89. There's none of that in here.
Wow.
So yeah, you can have something like I said that tastes good, and you can actually feel good about drinking it.
Yeah, those are really good. I'm a little shocked because when you said vegan and what's the other one? Gluten free. I didn't think
taste like cardboard.
Yeah, I really did. I thought it was gonna taste like cardboard and not have a taste at all. But y'all, I'm shocked. These are really, really good. I'm gonna have to get some because I stopped. I stopped drinking soda, so all I drink is lemonade and tea now.
Okay.
I would like to replace sugar lemonade and tea
With that.
with that.
Mm-hmm.
With that. So yes, please, y'all visit Simplicity Beverage Company on IG and Facebook.
Yeah.
And get your orders in. Get your orders in.
Starting next week, like I said, when I leave here, I gotta go check on my technical difficulties.
Okay.
So, because what had happened was we have inventory to ship,
Mhm.
but for some reason on the site it's showing as if everything's out of stock and it's not. And we're trying to figure out how that happened.
Somebody that has it. Mm-mm. We
They
do,
can
but
say it.
But we do though. We do.
Okay.
Some things just you gotta be okay with.
Yeah. If
We still us, you know.
Yeah.
If anybody is just joining us, you missed a wonderful show and lots of information. With the Dr. Kiovanni of Advanced Integrated Health. Is that right? Care. Advanced Integrated Care. She's a chiropractor. And y'all missed a lot of information. We can't even go over all the stuff y'all missed. But we will replay the videos so you guys can see. And if you have any questions, we could definitely forward them to Dr. Kiovanni to see if she has time to answer and get back to us so we can answer some of your questions.
Mm-hmm.
But yeah, y'all missed a good show. And now we're sampling her beverages, lemonades and teas from Simplicity Beverage Company.
Mm-hmm.
She has some really good tea. She has Basil Freeze, Island Time, and Fulfillment, MINT, and Guava Goodness.
Mm-hmm.
They are delicious. Delicious.
Mm-hmm.
And Lady K should know she was part of the original focus
I was
group.
the original.
What was your favorite?
All of them. No. Honestly, the hibiscus
The Island Time
and the what's the
basil or the mint.
the Fulfillment or the Basil
basil.
Breeze? The Basil.
it was the
Breeze.
basil and the hibiscus. Mm-hmm.
These are nice too to
For
take
me,
out.
it depends on my mood. I wrote all the recipes myself. I had to teach myself how. I didn't know how to do any of that,
Mhm.
Oh,
so I
wow.
taught myself how.
What made you want to get into the teas and the herbs?
Providing people a clean beverage
A
option
clean
because
beverage,
again,
yeah.
I've seen, people talk about gluten free, but if you want to Google and look up what a gluten allergy looks like. I had a young man in my office. We thought he had the measles. It was a severe gluten allergy. And
Oh,
he was literally
wow.
scratching his skin. The eczema was so bad from the gluten, he was literally scratching his skin off. So most people don't know they put gluten as a filler. So they put it in shampoo, they put it in salad dressing, they put it in beverage products because it's cheap.
Mhm.
So again, I know what that looks like on a day-to-day level. Someone who's suffering, who doesn't know what to eat or drink because they don't know how it's going to affect their body. And again, a lot of parents these days and adults the same are reading labels and they don't want the garbage. And I was like, well, let me just see. Can you create something that tastes good, that doesn't have a bunch of products in it, a bunch of what I like to call undesirables?
Yeah.
Yes,
Yeah.
you can. You guys just tried it.
And it's excellent.
It's delicious.
It really is good.
In fact, the other story about simplicity is one of my other patients, he did the logo for me.
Okay.
I needed a logo and didn't have time to find a graphic designer. So he was like, I'll do it. And I was like, great. Because I don't have time. Thank you. And he created the simplicity logo for me.
Oh, wow.
Okay.
Well, I am so glad that you were able to join us.
Me too. Thank you for inviting me.
You gotta come back though. You gotta come back. So we can get into.
I want to come back, but I want more questions. I want to know what people want to know.
Yeah,
that's
why we have to have you back.
I would love to know what people want to know, or want to ask, afraid to ask, don't have anybody to ask. A lot of people don't have a primary care or a PCP or someone that they can actually pose questions to and not be charged an arm and a leg.
Right.
So I would love to know, what the public wants to know or what they have questions about. That would be amazing.
Yeah.
Okay.
Yeah. Maybe we'll have her back in May. Sometime in May.
After the doctor segment.
Yeah.
I'll let them work. We call it niche.
Oh, well, because we're gonna be in these streets, so I mean,
wait, what? I didn't hear what you said.
We're gonna call the segment in these streets.
In these streets, not to ask the doctor, but in these streets.
In these streets.
What are your health questions in these streets?
I like that.
And you don't even have to be here for that. We can bring you on camera.
Yeah.
So you don't,
Right, because who knows where I'll be.
Yeah. That's fine. Yeah, we'll set a date and we'll let you know, but we would definitely love to have you back. If you want to come back or if you
Bring
want
more simplicity.
Yes, bring lots more. Yes, bring lots more simplicity. Yes. So, Advanced Integrated Healthcare, Sandy Springs. Do you have Facebook and Instagram for your office?
Allegedly. We don't use it.
Do you have a website?
Yes.
Okay.
Yeah, the website is advancemyhealth.com. Advance, ADVANCE, myhealth.com.
Okay. Advancemyhealth.com. Get y'all an appointment. Go get them backs right. Straighten up.
Get your nutrition right.
Get your nutrition right. Get your hormones right.
Yeah. Get some generational issues about your life.
Get all of that. All of that with Dr. Kiovanni. All right. So,
I just want to thank you again for coming by and blessing us with all the knowledge that we got today.
Yes.
And as Bayou Diva mentioned, we will definitely have Dr. Kiovanni back here.
Yes.
So send us any questions you may have, especially for our kings out there that may feel uncomfortable about asking their personal doctor, or if you haven't been to the doctor and you have some questions about your health. Send those to us. You can send them to our inbox at the Ladies Den, and we will shoot those over to Dr. Kiovanni. And
we will get some answers for you. We'll get those answers.
Yeah.
We'll get those. Absolutely.
Yeah.
We don't want anybody waiting.
And come back to you. Yes.
Absolutely.
Definitely. But thank you again and again and again.
Yes.
for
And
coming
thank you
by.
for bringing the delicious drinks.
Yes.
I guess I'll go ahead and leave here.
We gotta get some sound effects, son.
Yeah,
Yeah, they're on there, but we gotta put them on there.
Are they? Look,
So you want to
I mean, we can't listen. So, the ladies then, we clocking out early, I believe. So, looks like Dr. Kiovanni has been on here with us the entire time.
Yeah,
So, applause. Yay.
knowledge is power. Knowledge is power.
Thank you.
Okay. So thank you guys for stopping by the Ladies Den. Remember to follow us on not only Facebook, you're already on there, but we're also on Instagram and we have a YouTube page.
Please subscribe to our YouTube.
Please subscribe to our
Yeah.
YouTube page so we can do more stuff with it. And what?
Tune in next week because we'll be talking about I don't even know how to put it. Income. Does it matter who makes the most money, the woman or the man? So we'll be discussing that. Yes, we'll have a married couple here, and we'll have a single couple here to talk about, does it matter who makes the most money?
Right.
And are men uncomfortable if the woman makes more money? So we're going to discuss that. That'll be our topic next week. So hope you guys tune in. Thanks for chilling with us in the den.
In the Ladies Den.
We'll see you next week.
Bye.
Bye.
Okay, in that broadcast. Bye, y'all, for real.
Yeah.